Welcome to Functional Talk, the Functional Med for the People podcast, where we bring you the latest insights and practical tips on how functional medicine can transform your health and empower you to live your best life. I'm your host, Michelle Brooks, Doctor of Nursing Practice with over 30 years of nursing experience. Join me as we dive deep into the world of functional medicine, exploring the cutting-edge research, evidence-based practices, and real-life success stories that will inspire and empower you on your health journey. Subscribe to Functional Talk on your favorite podcast platform and join our community of health-conscious individuals who are committed to living their best lives as through the principles of functional medicine. Get ready to be inspired, educated, and empowered. Let's dive in. Welcome back to Functional Talk, the Health for the People podcast. I'm your host, Michelle, and today we're going to talk about a condition that almost half of American adults have, and about 46% of adults don't even know they have it. And then only 21% of Americans have it under control. So what is it? High blood pressure. So maybe you're asking, how do we see blood pressure from the perspective of functional medicine? Or how can you, the patient, be a better advocate in managing your blood pressure? Or what can you do about it? We're going to be looking at that through this lens today. So let's go ahead and dive right in. First off, let's talk about what high blood pressure is. When you get your blood pressure taken, they give you a reading of one number over a second number. The first number, the number on top, is the systolic blood pressure. And basically, it's the maximum amount of pressure or force that your blood is pumping through your body. The low number, the number on the bottom, is the diastolic blood pressure, and this is the force of pressure when your heart is at rest in between contractions, and that's the least amount of pressure in your body usually. So what is normal? What number constitutes a good blood pressure? A good normal blood pressure is 120 over 80 or below, but an elevated blood pressure over 130 over 90 must be evaluated by your healthcare provider. If your blood pressure becomes so high, like 180 over 120 or higher, this becomes what we call a hypertensive crisis, and it means you must be evaluated immediately. I can't emphasize enough that patients should know their numbers. If you take medication to control your blood pressure, you most likely have a diagnosis of hypertension. But now let's back up. How does it start? Where does this increase in your blood pressure actually start? Often it can be lifestyle factors, things like a high salt diet, sedentary lifestyle, drinking caffeine and alcohol, smoking, your family history, obesity, stress, and just getting older. One way that high blood pressure can start is through damage brought on through your diet. And I'm sure that is probably not news to many of you, but let me explain how. If you eat a diet that is high in fat, animal protein, and refined carbohydrates, this mix will increase your oxidative stress. This oxidative stress you can picture as rust, such as when iron rusts. Iron rusting is another form of oxidative stress. So what happens when iron rusts? Well, it corrodes, right? Two parts become rusted together. It might get fragile and break. Everything here that we're talking about with oxidation of iron is not good. So then imagine what happens when this occurs on the inside of your body. Besides your diet, other causes of this oxidative stress happen when you go through emotional stress, those individuals that live a sedentary life, and when you live in social isolation. Can you see why lifestyle factors play an important role in health? This oxidative stress causes damage to your blood vessels, and when your arteries become damaged, they can cause problems like high blood pressure and other issues. So there are some good reasons to look at how much fat, animal protein, and refined carbohydrates that you're eating. Now, let's talk about sodium. The government recommendations for sodium intake per day for a person is less than 2,300 milligrams. So how much is this? It's 1 teaspoon. 1 teaspoon per person per day. And less is better, especially if you're dealing with high blood pressure. Most Americans are taking in almost 1.5 times that amount on a regular daily basis. Continuing to take in this much sodium will increase not only your risk for high blood pressure, but also heart disease and stroke. So what are some ways that a functional medicine provider can look for the root cause of your hypertension? Well, most likely they will have done the full intake interview, looking at your diet, ask you about your lifestyle, your exercise, how much you're sleeping, how well you're sleeping, your stress, your relationships, and we'll start there with changes. Basic blood work sometimes they might order to help screen for any further risk of cardiovascular disease and any possible organ damage that may result from elevated blood pressure. It can also provide a baseline or a reference point when they're trying to make improvements in your lifestyle factors. Now, then there's blood work that looks at cortisol. Cortisol is your stress hormone, which will increase your heart rate, your blood sugar, and your blood pressure. They may look at toxins like mercury exposure and mercury toxicity because this can cause changes in the blood vessel walls that increase oxidative stress, which we just talked about that and how that can damage blood vessels. Sometimes they may want a stool analysis. Now, why would they want that, you'd ask? But the health of the gut is directly related to the health of the heart and blood vessel walls and the nervous system that controls the messages to speed up and slow down the heart and the blood pressure. A number of factors in the gut can lead to inflammation, which can lead to changes in your blood vessels. So, a stool analysis can lead to information on the gut and whether it might be producing inflammation that will affect your heart and vessels. Obviously, we're going to focus first on those lifestyle factors. Conventional medicine is going to focus on treating the diagnosis of hypertension. So, there are a few things that I want to point out here, and how they focus on the treatment of hypertension is that there's a formula, there is a protocol. They will gather the information. They will take information such as your cholesterol numbers, your history with diabetes and smoking, your weight, your age, your blood pressure, and they pump all this into a calculator. And I use this myself just to kind of figure out what risks are. But they will look at that risk, and then there's a protocol, and it will give them a standard protocol for treating blood pressure with medication. It will help them give them a protocol for whether or not they need to address cholesterol. And they also have specific lifestyle recommendations. With functional medicine, we look at the lifestyle factors because most likely there is a root cause here. And if we can address that root cause, then you would not need medication or may need less. So, in what ways can we address lifestyle factors? Well, let's look at number one. Number one, cut your refined carbohydrates. In other words, if you can't buy it, if you buy it in a box or you buy it in a can and it's more than one ingredient, it is most likely refined. Decreasing your refined foods can help you transform your health. The DASH diet, this is the Dietary Approaches to Stop Hypertension, DASH, exactly what it stands for. And basically, you eat whole foods. You eat vegetables, fruits, low-fat dairy, whole grains, poultry, fish, and nuts. And this type of diet will include many essential nutrients that you need, like potassium, magnesium, calcium, protein, and fiber. And it's low in saturated fat, refined sugars, and sodium. Now let's look at some nutrients. So specifically potassium. That is so important when it comes to your blood vessels. And it helps the blood vessel walls to relax and not constrict and spasm. Because when they constrict and spasm, this causes increased blood pressure. So you can make sure that you're eating a diet that has lots of high potassium foods with a daily goal of 3,500 to 5,000 milligrams a day. This is found in fruits, vegetables, apricots, lentils, squash, kidney beans, and spinach. There are certain people who need to be careful of taking in too much potassium if you have kidney disease of any sort. So always be sure when you're increasing something like minerals and vitamins, be sure to check with your physician, your healthcare provider, to make sure if they are on board with you doing this. Monitor your sodium intake. Remove the salt shaker from the table. Eat out less. Did you know that roughly 80% of the sodium consumed by Americans comes in the form of takeout food? So you can make it a point to eat in more often. Read your labels. Look at the sodium. Just because it says low sodium, that only means that it must have less than 140 milligrams of sodium per serving. But note the size of the serving, because sometimes we're eating 3 or 4 or 5 servings of a product, and that alone could be a quarter of your daily sodium intake. So be careful when you're reading labels. Even something that's sodium free, it can still have 5 milligrams per serving. Now, a high fiber diet, this can reduce your blood pressure as well. So, what else can you do? What else can you do? Maybe if you are being followed by a functional medicine provider and you're seeing your medical doctor, your nurse practitioner regularly for blood pressure checks, then maybe you might be able to opt for some additional supplements that could decrease your blood pressure and possibly help you reduce your medicine or need for continued prescription therapy. A lot of prescriptions often deplete your essential vitamins and nutrients. So it's important to work with your provider on developing any kind of supplement plan. I don't recommend doing this without proper supervision of your healthcare provider or a health coach. Often, when people make changes in their diet and they begin to stop eating processed foods and they eat whole foods with less sodium and they get a little bit of exercise, all of a sudden they may need to have their medication doses decreased or they may not need them at all. This happens quite a bit. So, first things first here, you need to practice self awareness. And you can't be aware if you're not checking your blood pressure or if you just don't even know what your numbers usually are. Most likely, you've had someone check your blood pressure in the past year at a regular checkup or at a doctor's visit. If you're not sure if you have high blood pressure, you can always get a home monitor for a reasonable price. Being able to monitor your blood pressure yourself is a valuable skill to have when it comes to your health, and even recommended by national committees like the American Heart Association. They support this. And it becomes even more important if you do develop high blood pressure, and especially if it's uncontrolled. Being able to check it at home might be able to let your doctor know if your hypertension is what we call white coat syndrome, where it's only elevated in the doctor's office, but then it's normal at home. And then it can also help the doctor know if your medications that they prescribe are working. And another thing is that by monitoring your blood pressure at home, you might be able to catch something like an increasing trend or a decreasing trend if you're making all these lifestyle interventions. And by keeping track of it going, lowering or going up, it helps you to be able to get sooner attention rather than waiting until your next doctor visit and find out that it's higher or lower. So having that day by day monitoring of that trend. So here's a really good question. How do you pick up a blood pressure monitor? How do you get one? How do you know which one to get? You can look for the statement that they have been clinically validated. This means that it has been tested to be accurate. If it doesn't say so, I'm going to say most likely it's probably not. The good news here is that you can find a reasonably priced monitor even on Amazon, and both FSA and HSA consider this expense to be reimbursable. The important thing is to bring it with you to your next doctor appointment and check its readings with the reading from the doctor's office. If you cannot afford your own monitor, check around your community. If you're over 40, you may qualify for free blood pressure checks at your local pharmacy, so you can give them a call. Also, check with your local fire department to see if they offer free blood pressure checks. So, what kind of monitors should I choose? And as a nurse, I've seen many of these wrist monitors, and often I've seen them used incorrectly. And you could I do recommend actually the one that goes from it's called the brachial cuff, and it goes from the elbow to the shoulder. So, it's on the upper part of your arm. The other thing you want is you want a fully automated cuff. You're doing this at home alone, most likely. And so something that's easier for you to slip on and press a button. The manual blood pressure cuffs, though, most of them are deemed the most accurate. And if we were working in the hospital, we would always recheck with a manual cuff. But you want something that's automated, easy for you to use. Now, size. It must be the right size. I can't tell you how many times I've seen people take a blood pressure with the wrong size cuff. A standard cuff comes with these monitors. And for a third of the patient population, it is generally too small of a cuff size. So, how do you know if the cuff fits or not? Well, that inflatable part of the blood pressure cuff should reach from almost the elbow to the crease in your elbow and your arm there to your shoulder, to your armpit. That's about where it should reach. It should cover 75 to 100% of the distance on your upper arm. Now, having a monitor that has memory of your past readings is also very nice. It may help you to be more active in recording your results. It's very helpful to go for a checkup and show the doctor your readings. But sometimes these are more expensive, and you can just as well go with a lower cost blood pressure monitor and just keep a notepad and pen by the monitor so you can record, or you can take a picture of your phone with it, because then it'll give a date, time, and stamp with it, a date and time stamp. There's also apps that you can use that will record things like this, like your Apple Health or Health Connect on Google. I would mention bringing your monitor in every time that you visit the doctors, or at least every 6 months, can ensure that this is measuring correctly. Now, I'm going to give you some advice about checking your blood pressure. So, how many times have you rushed to the doctor's appointment, you get brought back, and the first thing they do is take your blood pressure, and what? It's high, right? Be sure to rest 5 minutes before taking your blood pressure. So if you're at the doctor's and it records high, ask them to check you back again after 5 minutes of sitting still. Here's another thing. Did you grab that latte on the way? You want to be sure not to smoke or drink any caffeinated beverages for at least 30 minutes before they check it. You want to make sure you take your blood pressure before you eat and not after. And you want to make sure you're sitting comfortably with your back supported, both feet on the floor, you're not crossing your legs, and have your arm elevated to where your arm is at heart level. Well, the cuff should be really at heart level on a table or a desk. And I have had the nurse come on in to take my blood pressure, and she takes my arm and she puts it between her body and her arm, and she's holding it there. She pumps up the cuff. And to me, that's very uncomfortable. I'm uncomfortable when they do that. And so could that be the reason that my pressure has been elevated at times? I very well could be. So make sure you're comfortable. If they do something like that, you're uncomfortable with it, just try to ask them, put your arm elevated on a table or a desk. Make sure that it's resting somewhere, that you're not holding it. Okay. The other thing you want to do is you want to make sure you're we talked about the proper size cuff. It should fit smoothly and snugly around your bare upper arm. You shouldn't be doing it through clothes. You should do a bare upper arm. And you should be able to slip one fingertip under the cuff. So it shouldn't be wound so tight around your arm that you can't even get a finger in there. You should be able to get one finger under the cuff. The bottom edge of the cuff should be 1 inch above the crease of your elbow. Now, let's ask these questions. How often, right? How often should you check it? And that is going to depend about what's going on. And if you truly want to know how often you should check it, you can ask your healthcare provider. They will give you a very good answer. If you get a monitor or you get it checked by someone other than a doctor and it's above the 130/90, you're going to want to let your doctor know, and they will most likely want to see you. And that's when they may want to do some of that initial lab work to see where your actual cardiovascular risk numbers are, like we talked earlier. If it's under that 130/90, then you may want to try to check it at various times when you've got a headache, when you're under some stress. If your doctor asks you to check, then follow his or her recommendations. But if you do have a family history of high blood pressure and heart disease, or if you're overweight or obese, then you're going to want to check it morning and night for at least 3 to 4 days in a row. This gives you an idea of how your blood pressure trends. There's that line again, that trending line, whether it goes up or down, or if you should try to get an average of those 3 to 4 days in a row, morning and night. However, I'm going to default as a nurse coach for people that the best schedule is going to be the one that works for you. The times that you will be most ready to check and track the readings. Despite what a good routine it may be, it's not helpful to have a routine that you're against, or you feel that's imposing on your life, or you're trying to get kids out the door to school, or you're trying to visit with family, or you're working. And so it has to be something that you can maintain and is good for you. As we discussed earlier, if your blood pressure is at that 180 over 120 or higher, you're going to want to contact your physician's office right away, regardless of the time of day or the time of the week. Now, if you have any other symptoms with that high blood pressure of 180 over 120 or higher, if you have a headache, chest pain, shortness of breath, if you have any dizziness or visual changes, you're going to want to go ahead and contact 911. Well, I really hope that you've enjoyed this information, that it's been beneficial to you, but I want you to remember that this information is not meant to treat or heal. It is for your educational purposes only. It does not replace your need for a primary healthcare provider. I hope you found this helpful and that it empowers you to take action in your own plan of care. I hope you have a wonderful week. Please reach out if you have any questions through my website at my4dwellness.com. We'll see you here again next week on Functional Talk, the Health for the People podcast. Thank you so much for joining us for another episode of Functional Talk, the Functional Health for the People podcast. I hope that today's talk has been informative and useful for you. Just a reminder that Functional Talk does not replace the care provided by your healthcare provider. Information that is given here is not meant to cure disease, but solely as an educational service to the healthcare consumer. You can find us on social media at Dr. Brooks RN on Instagram or My4D Wellness on Facebook. For more information, you can check out our website at my4dwellness.com. You can also email or direct message with any questions. If you're enjoying our podcast, be sure to follow, like, and share. We hope to see you back here again next week on Functional Talk.